If you experience sharp pain or discomfort when bending forward to tie your shoes, pick something up, or empty the dishwasher, you're dealing with one of the most common complaints among seniors. Back pain when bending can prevent you from performing essential daily activities and significantly impact your quality of life. Research published in the Spine Journal in 2012 examined lower back pain in older adults during forward bending movements. The study found that weakness in specific muscle groups, particularly the core stabilizers and hip extensors, was strongly associated with pain during bending tasks. The good news is that targeted exercises can address these weaknesses and reduce pain. Before we begin, share with us now in the comments your age and where you're watching from. We read and try to reply to every single comment. Let's explore these 3 exercises that can help reduce your back pain when bending. Exercise number 3, Child Pose Rockbacks. Child Pose Rockbacks combine gentle stretching with controlled movement to improve spinal flexibility and teach your body how to move through a bending pattern without pain. Research published in the International Journal of Yoga Therapy in 2013 examined yoga-based exercises for chronic lower back pain in older adults. The study found that gentle spinal flexion exercises, including variations of child's pose, significantly reduced pain and improved functional ability. A study in the Journal of Physical Therapy Science in 2016 found that controlled spinal flexion exercises helped restore normal movement patterns in people who had developed fear of bending due to back pain. To perform Child Pose Rockbacks, start on your hands and knees on a comfortable mat. Position your hands slightly forward of your shoulders and your knees hip-width apart. Keeping your hands planted, slowly push your hips backward toward your heels. Your arms will straighten as you move backward. Only go as far back as feels comfortable. You should feel a gentle stretch in your lower back, but no sharp pain. Hold this stretched position for 2 seconds, breathing normally. Then slowly rock forward, returning to the starting position. The movement should be slow and controlled, like a gentle rocking motion. Start with 8 to 10 repetitions. Perform 2 sets with a minute of rest between. As you become more comfortable, you can sit back further toward your heels, but never force the stretch. Exercise number 2, Bird Dog. The Bird Dog exercise strengthens your entire core, including the deep stabilizing muscles along your spine. These muscles work together to keep your spine stable when you bend and lift. Research published in the Journal of Strength and Conditioning Research in 2010 found that exercises requiring coordinated activation of multiple core muscles, like the bird dog, were particularly effective at reducing pain and improving function. Before we continue, if you've been enjoying the video so far, hit that like button so more seniors can see it and subscribe. To perform the bird dog, start on your hands and knees on a comfortable mat. Position your hands directly under your shoulders and your knees under your hips. Keep your back in a neutral position, not arched or rounded. Engage your core by gently pulling your belly button toward your spine. Slowly extend your right arm straight out in front, while simultaneously extending your left leg straight behind you. Your arm should reach forward at shoulder height, and your leg should extend back at hip height. Keep your hips level. Hold this position for 5 seconds while maintaining your balance and keeping your back still. Slowly return to starting position. Then repeat with your left arm and right leg. That's 1 complete repetition. Start with 6 repetitions, alternating sides. Perform 2 sets. As you build strength, work up to 10 repetitions per set. If the full bird dog is too challenging, practice extending just your arm or just your leg until you build enough stability to combine the movements. Perform this exercise 3 to 4 times per week. Most people notice improved back stability within 4 to 6 weeks. Exercise number 1, Alternating Supermans. Alternating Supermans strengthen your lower back extensors and glutes, the muscles responsible for straightening your spine when you return from a bent position. Many people with back pain when bending have weak extensors, making it painful to stand back up. Research published in the Journal of Back and Musculoskeletal Rehabilitation in 2015 examined back extension exercises for chronic lower back pain. The study found that regular practice of back extension exercises significantly reduced pain intensity and improved functional capacity in older adults. To perform alternating Supermans, lie face down on a comfortable mat with your arms extended overhead and your legs straight. Rest your forehead on the mat or turn your head to one side for comfort. Engage your core and glutes slightly. Simultaneously lift your right arm and left leg off the floor about 3 to 4 inches. You don't need to lift high, just enough to feel your lower back and glute muscles working. Hold this lifted position for 3 seconds, then slowly lower back down. Immediately repeat with your left arm and right leg. That's one complete repetition. Keep your movements controlled. Your neck should remain neutral. Don't crane your head up. Focus on squeezing your lower back and glute muscles. Start with 8 repetitions, alternating sides. Perform 2 sets with a minute of rest between. If lying completely flat causes discomfort, place a small pillow under your hips for support. Perform this exercise 3 to 4 times per week. Most people notice improved strength when returning from bent positions within 3 to 4 weeks. Putting it all together, these 3 exercises work together to address back pain during bending. Child Pose Rockbacks improve spinal flexibility. Bird Dogs build core stability. And alternating Supermans strengthen the muscles that help you return from bent positions. Create a simple routine. Perform Child Pose Rockbacks daily since they're gentle. Alternate Bird Dogs and Supermans on different days, performing each 3 to 4 times per week. The entire routine takes less than 15 minutes and requires no equipment. If any exercise causes sharp pain, stop and consult your healthcare provider. Mild discomfort or muscle fatigue is normal, but joint or nerve pain signals you need to modify the movement. Conclusion: back pain when bending doesn't have to limit your life. By improving spinal flexibility, building core stability, and strengthening your back extensors, you can significantly reduce pain and move more confidently. Most people notice improvements within 3 to 4 weeks of consistent practice. The key is patience and proper form rather than pushing too hard too quickly. Now, we want to hear from you. What daily activities cause you the most back pain? Which of these exercises will you try first? Share your experiences in the comments below. Thanks for watching.